listen up and memorize. I've got a song to lock this process in your ears and eyes. Here's number 1, call 911 and give them your location and the patient's description so they can send you medic guys. Next, get the gloves on and I'll mention this for your protection. Third, choose a method, you've got options, nasal or injection. Administer the injection or the ingestion. And fourth, hurry up and put them in the recovery position. Alright, chill out for a sec. Monitor their condition. Check their pulse. And if they don't start breathing again in 3 minutes, give them another dose.
The brain has many receptors for opium. An overdose occurs when too many opioids fit into too many of the receptors, which slows and stops breathing. Naloxone has a stronger affinity to the receptors, which means that it can knock loose the opioids and allow the person to breathe for a few seconds, and this is what reverses the overdose. They come with 2 different methods for administration. There's a nasal spray and there is a needle. You can get naloxone kits for free around Peterborough at drugstores, health centers, or the hospital. The important thing to remember is that all naloxone kits have an expiry date. The needles will say around the top, and sometimes the nasal sprays have them on the inside. There's no effect to someone that doesn't have fentanyl in their system, but you want to make sure that you're not providing naloxone to someone that doesn't need it. If there's no more qualified personnel nearby, it's important that you start right away. Overdoses can last from minutes to hours, so it's important not to waste time. The first step always is putting on the gloves provided in the kit. This will protect you from any possible toxins on their skin, around their mouth or eyes, and can prevent you from harm. All you have to do is peel back this packaging here, you put your fingers up here, and you push with your thumb and inject the spray. Once you've injected the spray, lay them in the recovery position and wait for emergency personnel to arrive. The second method is more complicated and takes a bit more time. Just like the first method, the first step is putting on the gloves to ensure your own safety. After that, there are 2 packets inside. Both are the exact same. They contain 1 needle and 1 vial of naloxone. After the gloves are on, remove clothing obstructing the shoulder of the patient and wipe it down with an alcohol swab provided in the kit. This will ensure that there's no risk of infection. Next, take the needle out of the package and remove the cap. Draw back the plunger to the 1 mm mark and stick it in the top of this vial. You can then depress the plunger and put the air into the vial, and once the tip of the needle you can see it's in the liquid, draw back the plunger to the 1 mm mark again and take it out of the vial. You then push the air bubbles out of the tip of the needle, and sometimes you might have to tap it. Carefully inject the needle into the middle of the shoulder where the most muscle is and insert it all the way. You can then depress the plunger all the way to make sure that all of the naloxone in the syringe has been administered to the patient. You then remove the needle from the shoulder, and the tip of the needle will retract back into the chamber, and you can put the needle back into this tube that it comes in. So to recap, make sure you've called 911, make sure they're aware of your situation and your location so they can send help. Next, make sure you've put on the gloves, which will reduce your risk and make sure you're safe. Administer the naloxone and lay the person on their side in the recovery position. At this point, if the person starts to breathe again, you can gently try to wake them up, or if not, wait for emergency personnel to arrive.